When we come back, we have Darko Prce, who's a biochemist and a leading health expert. He's going to explain that, and later on he's going to take your calls and your health questions. In order to put today's topic in perspective, just think of a typical pharmacy. And apparently, the digestive relief aisle of the pharmacy is the longest aisle. Darko Prce drew that to my attention because you spend a lot of your time helping people with different digestive conditions. And you say that they're so important because it's the basis of your immune system.
It is. 80% of your immune system is found within the small intestine. It's called the gut-associated lymphatic tissue, sometimes referred to as Peyer's patches. And there's a lot of good bacteria. We know of at least 400 different species of good bacteria that keep the bad bacteria in check. And in fact, we usually have 85% good bacteria and 15% bad. And that's the ecosystem that we need to maintain.
So the problem is when the bad bacteria take over and deplete the good bacteria.
Exactly.
I mean, it's really interesting. They're putting a form of probiotics, and it's become the real ad campaign. They're slipping it into everything.
Yeah, absolutely.
But the conditions that you're wanting to talk about, because you say that almost everything is formed you say your gut is formed really, really early on in development.
Yes, actually, when a woman is pregnant with the embryo, at about 4 weeks, the eye, the neural tube, and the gut form, the foregut, midgut, and hindgut. And unless an organism has a gut that's healthy to absorb the nutrients, to allow the organs to develop and grow, and a nervous system to coordinate all this, you can't be born.
And a lot of people deal with nutrition issues. Malnutrition is huge, but just go through some of the gut-oriented conditions that so many of our viewers are probably navigating right now.
Well, I think we've all seen the commercials for the gas, the bloating, the heartburn, and unfortunately we seek symptomatic relief, and we're not looking at what's at the root cause. What is the digestive system trying to tell us? Are we not able to digest a particular food? And going to the drugstore or to your physicians and getting a H2 blocker, they're histamine blockers which block hydrochloric acid from forming, or proton pump inhibitors.
Who has reflux, is
exactly.
That correct?
And what that does is it increases the pH, which is kind of a little bit confusing, but you increase the pH, making it less acidic, so when it splashes back up in the esophagus, you don't feel the pain as much, giving you symptomatic relief.
But your body should pay attention to pain because there's obviously something else on the go there. But I mean, Crohn's, colitis, celiac, I'm thinking of all kinds of other sorts of conditions as well, which are even more serious than the ones that people are taking over-the-counter remedies for.
Yeah, absolutely. We have it all starts somewhere, and usually gas, bloating, heartburn, digestive discomfort, maybe a feeling of heaviness, maybe burping and regurgitating foods is a problem. A little further down in the intestines, where we have things like Crohn's, which affects and it ulcerates the little villi in the small intestine, so we can't absorb our foods.
We, in a few minutes, are going to take your calls and questions. 613-750-1211 or 1-888-750-1211. But a lot of the people at home want to know what we have on the table and why.
Yes.
Darko, what exactly do you have here? You have digestive enzymes, you have probiotics.
Yes, we've got the whole gamut, so it doesn't matter what the issue is. So, for example, if you're having trouble with the bad bacteria and you need to repopulate your gut to get it back up to that 85%, probiotics. Many different types, Lactobacillus acidophilus and Bifidobacter bifidum are the two most common.
Yeah, you're going to be looking at Darko's shirt for subtitles,
yeah,
but essentially, you don't need to know how to spell it, you just need to know how to ask for it. But essentially, if you've taken antibiotics, that depletes the good and the bad bacteria in your system, so you want to repopulate?
Yeah, antibiotics, birth control pills, chlorine in the water, antibiotics in the food supply, all these things are working against us.
And so next to, so that's all probiotic.
Yeah, these are all different types of probiotics.
And what do we have here?
Over here we have digestive enzymes, and individuals who are having trouble digesting their food and they're getting these signs of gas, bloating, heartburn, etc., rather than suppressing the symptom, take a look, find yourself an enzyme. Enzymes are like little workers that chop up your food for you, and they're working in your stomach, chopping up your food to itsy-bitsy pieces so we can absorb them.
So if you're reaching for Pepto-Bismol, instead reach for something like this.
Exactly.
Reach for the phone, though, in the meantime, because after the commercial break, Darko is going to take your calls and questions if you have a health concern. We'll be back with that. Exactly. We are going to get right to your calls and questions with Darko Prce, who is a biochemist and a health expert, and we have Mike on the line right out of the gate. Hi, Mike. What can Darko help you with?
Hoping to get a biochemist's view on cleanses, both oral, possibly colon, just how beneficial they are, given the body already has its own filter systems.
Yeah.
Great question.
Yeah, it is a great question. And yes, the body does have the liver, the kidneys, the bowels, the lymphatic system, and the skin. Those are our elimination organs. And each one of these has specific nutrients that helps do its job. So when you take a look at your liver needs specific amino acids to run its pathways and vitamins to induce detoxification. And then you need soluble fibers to absorb that bile to excrete it completely out of the body. So there's a little bit of chemistry that has to be supported for each one of these organs.
I guess Mike might be asking if the body's built to do this naturally, do we need to be buying those kits everywhere?
It is. However, unfortunately, due to soil depletions, we no longer have those nutrients necessary in those foods. And because there is so much more pollution in our environment today, we need to super bolster our detoxification organs.
Excellent question, though, because but you should also be very careful when you do cleanses. It's like beating a rug, isn't it? You can get rid of some of the fibers you need to hang on to if you're not doing things appropriately guided.
Some of the clinical studies have shown that if you actually induce detoxification without supporting the pathways properly, you can actually cause more harm than good.
So that was an excellent question. We have Barbara on the line. Barbara, your question for Darko.
Hi. I'm suffering from candida, and how do I treat that or get rid of it?
So glad you called with that, because that's a digestive one that we forgot to mention, and it's huge, isn't it?
It is. Candida is becoming an epidemic in our society. We mentioned a little bit earlier, 85% of the gut is good bacteria, 15% is bad. Of that bad bacteria, Candida is a natural resident within our intestines. However, when it gets out of control, it starts to spread, and it creates something called micelles, and it pokes holes into our intestine, causing a leaky gut syndrome. Now, in order to fix it, what we want to do is we want to first displace the bad bacteria with things like grapefruit seed extract, oregano oil, and things like plant tannins and undecanoic acid, which is a antifungal agent used in foods for over 50 years. And once you've killed off the bad bacteria, now you can replenish the good bacteria, but specifically a type of bacteria called Saccharomyces boulardii, and it's a big word.
Is there another name for that we would ask for?
Unfortunately, no, but
Saccharomyces
boulardii, and what it is a specific strain of probiotic which displaces problematic yeast species in the intestines.
And that's what Candida is, isn't it? It's a dysbiosis, or it's an overgrowth of yeast?
Yes, it is.
Okay, that was a great question, Barbara. And you can watch this again online if you need to hear Darko's answer to the Candida question. We have Katarina on the line. Katarina, your question.
Good afternoon. My name is Katarina. I'm just wondering what would be advice for people with psoriasis or eczema, and what kind of the medication to use or cleanse to clear up and help us.
I'm afraid I didn't hear about all of your question. I think you were asking about eczema, Katarina?
About psoriasis and eczema.
Is it psoriasis and
Yes.
eczema? Okay,
Yes.
great. Thank you. I'm sorry, it's loud in the background here, so we couldn't hear you clearly. Psoriasis and eczema.
Yeah, so a little bit, both obviously conditions of the skin. Eczema is basically dermatitis, inflammation of the skin. That most times comes from your intestines. You have an inflammatory condition in your intestines, and it's manifesting out on the skin, whereas psoriasis is your skin that's turning over 1,000 times too quickly, and there's something called cyclic AMP, and it regulates how quickly your cell turns over. What you want to do for psoriasis is you want to put adequate amounts of vitamin A, vitamin D, herbs like Coleus forkscoli, and take a look at some maybe autoimmune tendencies that might be there, antibodies that might be elevated.
Well, you know, so many of our viewers deal with eczema and psoriasis, and whenever we have a skin-oriented segment on, we get a lot of calls and questions. So is eczema not as serious as psoriasis?
Well, I think they're both obviously painful, and cosmetically they're undesirable, of course, and these are the symptoms. We must remember these are symptoms. These are not causes. Dermatitis is just merely inflammation of the skin. Psoriasis, what's at the root cause? Utilizing topical remedies to give yourself relief in the short term is obviously a good thing.
Does it come back to the gut?
It does come back to the gut, but it's a sum total of the whole. So for example, if your gut is healthy, but your liver and your bowels are dirty, then your blood is dirty and it will manifest coming out the skin, which is an elimination organ.
So should you sometimes, I'm stuck on skin, should you sometimes be relieved that it's expressing through the skin?
Well, I think that any time that our body gives us warning signs, we don't like it, of course, but I think it's a good thing because it's like a fire alarm. If it goes off, it gives you time to get out safely. This gives you time to deal with it before it becomes too much of a problem.
Okay, so that's a way to look at it. If you're dealing with eczema or psoriasis, in fact, your skin is waving a flag that you have to pay attention to something else. But we have Andrew on the line, and Andrew, we have to ask you to ask your question really quickly, and Darko, you have to be fast with the answer too, if you could. Andrew.
Hi, yeah, I have Crohn's disease, and anytime I have a flare-up, my GI seems really quick to pump me full of prednisone. And the effects of that aren't so great. He hasn't really gone into any natural solutions that I might be able to take to sort of control things. I was wondering if you had any suggestions regarding that.
Absolutely. The first thing what you want to do is you want to get therapeutic amounts of vitamin A for mucous membrane health and turning over of cells. The villi in the small intestine turn over every 72 hours. You need zinc to transport it for wound healing. Amino acids such as L-glutamine, which we looked at a little bit earlier, for feeding the enterocytes in the intestines, taking away any offending foods, most grains in the short term. There's wonderful books called Breaking the Vicious Cycle by Elaine Gottschall that tells you all about that. And obviously looking at you as a whole, what's causing it. In the short term, prednisone, it's mandatory for symptomatic relief, but what's at the underlying cause, how are we going to deal with it? And we have a whole host of vitamins, minerals, amino acids, herbs, homeopathics that can help heal those intestines.
So people should feel hopeful always.
Oh,
there's
always.
an answer. There's an answer.
There's always an answer.
Now, thank you for answering those questions so lickety-split. We're going to be back after the 12:30 news, and you'll have another chance to ask a question of Darko. We'll have the number back for you as well. Thanks a lot. We are back with health expert Darko Prce, and I know a lot of you have been waiting on the line, so thank you for that. And I think we're starting with Samantha. You've been waiting a long time to ask your question of Darko. Samantha, hi. Thanks for that.
Hi. My question is regarding gallstones. I recently had to go to the hospital for them, actually just before the holidays. And I'm just wondering if there's anything else that I can do in case another flare-up happens, if there's anything I can take or...
This is very interesting because so many people deal with gallstones after the holidays, after they've indulged, right, Darko? So what can Samantha do?
For gallstones? Well, gallstones are basically cholesterol out of solution and they've hardened. And what it is your liver is a big filter, and just below that is a little sac that maintains the bile, and it concentrates it and it turns it into a stone. And unfortunately, it's a sign that your filter needs to be cleaned and changed. Now, unfortunately, sometimes gallstones become too big and they can become lodged in the bile duct and cause complications like pancreatitis, jaundice, etc. So I would highly recommend that you go to a healthcare provider to deal with this because it could be a potentially serious condition. However, many different herbs beneficial for it. One of them we actually have on display, Swedish bitters.
And that's been used forever, hasn't it?
Hundreds and hundreds of years. Yeah.
Okay.
And
you can actually have a number of gallstones, can't you?
We usually have hundreds of small ones, but it's the big ones that are troublesome. And most adults have gallstones, but they're silent gallstones. We don't even feel them.
Interesting.
And we have some wonderful herbs. One specifically from South America is called Chanca Piedra, and it's called stone breaker translated for those who are from that part of the world. And you can break down the stone. You can use things like lecithin to put cholesterol back in a solution, bile salts to disperse them, and most importantly, soluble fiber.
Very interesting. It brings us back to the gut again.
Always.
We have Teresa on the line. Hi there, Teresa. Your question for Darko.
Yes, hello. I've got a daughter with Crohn's, type 1 diabetes, and celiac disease. She's currently on Remicade. What can she take for her body to absorb the nutrients as well as replace the bacteria in her body?
Excellent question. I think you said Crohn's, celiac, and I didn't hear the third.
Type 1 diabetes.
And diabetes.
And diabetes?
Yes.
Okay, so diabetes, you have to balance the blood sugar, low glycemic index foods, get a good multivitamin, exceptional amounts of chromium, preferably picolinate form, highly bioavailable, and vanadium, which mimics insulin. We've used vanadium for the treatment of diabetes since 1932, and it was even in the medical dictionaries back then. In terms of the celiac and the Crohn's, you have to heal the gut lining. This is going to be a little tricky, but you're going to have to take away most carbohydrate foods because disaccharidases are what's causing the problem. To help you understand this, there's a book called Breaking the Vicious Cycle by Elaine Gottschall. You can utilize things like L-glutamine, marshmallow root, DGL, N-acetylglucosamine, and a host of other remedies to help heal the gut lining, vitamin A, zinc, and once the gut is healed, and you can absorb your nutrients, obviously health is going to return.
Now, we have a link on our website to Darko Prce's website, which is biosishealthcare.com, and that was a lot of information for everyone, Michael. So this is a case where we're really encouraging everyone to go to the website and watch the segment again so that you can hear all of those, those very long words.
Yeah, for sure. Some great information there that just about everybody can use. Thank you, guys.
Thanks, Michael.